Can you start?
Yes, sir. Good morning, sir.
Good morning. Just
Yes,
brief introduction. You go to your aim and study objectives, and then aim and study objectives. You then go to your methodology.
yes, sir. So my name is Cesar Nichidi. My study is on knowledge, attitude, and practice of home management of acute diarrhea among mothers, caregivers of under 5 children in rural communities of Rivers State. Yes. This is my outline. So background, acute diarrhea is one of the leading causes of morbidity and mortality. And in Nigeria, diarrhea disease is among the top 5 causes of under 5 mortality and accounts for approximately 10 to 16% of childhood deaths annually. And home management of the acute diarrhea, is a cornerstone of child survival strategies, as timely and appropriate care can prevent dehydration, complications, and death. Despite the ongoing public health interventions, diarrhea disease remain common, suggesting that caregiver-related may be contributing to poor outcomes.
Can you go to your aim and study objectives? We don't have a lot of time.
So my aim,
assess the knowledge to determine the attitude to no.
The aim is to.
Oh, don't move like that now.
Sorry, sir.
The whole management practices, relationship between caregiver knowledge and then. What is the difference between objective 4 and 5?
Okay, so the objective 5 now is to look at
the same thing. Is that what your supervisor told you?
No, sir. Actually, I added that 5th one.
No.
Because I was looking at it.
No, because the cross be between the practice and the practice. Oh, okay. No.
Yes,
no, it's all right. I think it's in order. So, which means that you are looking at, you are not
how
just
each of them, how each of them affects the other. Yes, sir.
But you are looking at the okay. It's all right. You can leave it.
Okay, sir.
Okay, methodology.
Yes, sir.
So these things, no, waka like that now. Small. Go back. Let me see. Okay. Study area. He said it's rural communities in Rivers State.
Yes, in Rivers State.
We don't like to put selected though. In public, we don't do selected.
Okay.
We want our study population are selected using probability sampling methods so that they can be generalized. You can say rural, because this study is on rural communities in Rivers State. So you tell us about rural communities in Rivers State. You have done the work, but
yes, sir.
2 types of rural communities in Rivers State, especially when it comes to diarrhea diseases. You have the upland and the rural communities. You are from Rivers State, eh?
No, sir, I'm not.
But you have you chop oil for Rivers State. So there are 2. Those are the 2 types, eh? Okay.
Yes.
So you move on.
So the study design was
no, just move on.
Okay.
Okay. So, the inclusion and exclusion criteria. The study population, rural communities in Rivers State, and we say they are made up of upland and rural, upland and riverine.
Riverine, yes.
You are not going to include those that have managed diarrhea in the last what is it?
6 months preceding this
months. Don't. You are not. Just let it, because if technically if we begin to tell you, it's difficult for you to go and do. Because even if once they are mothers and caregivers, they are taught. They are taught. You don't need to have managed it before you can assess their knowledge, because it's as if you have to die first before you can say something about death. No.
Okay.
You have to know. So you have to remove this whether they have managed in the preceding 6 months.
6 months.
Okay.
Okay, sir. So sample size.
Okay.
I use the Cochrane.
Okay, sample size. Okay, use Cochrane.
Yes, sir.
You added.
Yes, we used the P of another study, which was 47%, and then by the time
no problem. So we can accept this now. Although if
yes,
those people from Benin they talk about design effects, but it's all right. You don't do.
This is okay. 421.
No, the sampling method. The sampling method. The
40-stage sampling. Yes, sir.
Yeah, the first one is to select how many local government areas did you select?
10 from the 23.
Hey, that's you don't lie. You don't lie. You don't lie.
No, sir.
No. Out of the local government areas, how many? Sir. Out of the rural local government areas, how many did you select?
Yes, sir. So we said that we selected 10 out of the rural local government areas.
Oh, if you select, it means that you conducted a study in 10 communities. In 10, you will conduct a study in at least 10 communities.
Yes, at the second stage, we now went to ward level, selected 2. Then
that's you know what I'm saying. Yes, I'm saying. See, okay, please. Yes, I'm not sure that Professor Tobin West saw the sampling. I don't know, because what the external examiner will be looking at your sample, your methodology, your sample size, and your sampling method. In fact, yes, some of them, once you get the sampling method wrong, they will just say that you have not done anything. See, you know, with experience, you cannot manage more than 4 communities. You can't manage 4 communities. So if you told me, in fact, from what you have stated now, you said you conducted the study in 40 communities. I can swear. I don't know. You know, as an African, we are not afraid of God. God, they even allow you live up to Methuselah before it will kill you. I can swear.
Nothing to swear. Even one community, one will be tired. Talk less of 40.
40, they say, I mean, if they lie, make you lie the one where person no go argue. So, Augusta, this thing is a falsehood there. And I will probably, what I will advise, you certify into rural and urban LGAs. You can select 1 LGA each, one upland, 1 riverine. I've seen Andoni. Yes. You can select Andoni, and then you can select any of the local government areas. But don't select Obebemao, because now my local government, because I know say, because I know go ask them whether they see anybody like you. So don't select, you can select one each. And then from the second stage, you to select
the words.
1 word. You can select 1 word now. Select 1 word from each of the local government area. That is a total of 2 words. Yes, and then you can calculate, you can carry out the study in the word. So the final stage will be to select community using systematic sampling. Sampling method, not cluster.
Yes, sir. Yes, sir.
Now, director now be a supervisor, may not go embarrass them with an examiner. Just move on.
Yes, sir.
So make those corrections. Just move on. No mention say you do them for 40 communities.
Yes, sir.
Then
So
the questionnaire
yes, sir.
done, you have to tell us how you assess knowledge, how you assess attitude, and even practice. And that practice. So how did you assess practice?
So for practice, it was assessed through reported actions. There are we ask questions, and then from the reported answers to those questions.
Mm-hmm. So you at the end now, how were you able to categorize them? Categorize this thing. Categorize the practice into good or poor practice.
Yes, sir. We used 50%.
No, he didn't state now. He didn't state 50%. He didn't state 50%.
So the total scores were converted to 50%.
No, you didn't mention it now. You didn't mention. You mentioned it in knowledge. 50%.
Yes, sir.
50%. The attitude, 5 point like a skill.
Yes, sir.
And you are mentioning positive at 50%.
Sir?
Positive at 50%.
Yes, sir.
You know, Sabi statistics. So. You know, Sabi that is like a scale. You know, Sabi. Go back and look at the lecture slide, and how Laka scales are at the end you can classify them into positive and negative, but not with percentage, because you are dealing with a Laka scale. Laka scale is not a percentage thing. Then
yes,
we are talking about this practice. This home management has different components. It's
yes,
not
sir.
just whether they managed it at home, but how they constituted the ORS.
Yes, sir.
How they constituted the ORS. So you should have this practice should have been assessed with a checklist. Sorry, not a checklist, a set of questions. A set of questions, and at the end you can rate that if they practice, say 4 out of 5 or 3 out of 3, at least 3 or more, that they have a good practice. And those are the ways of assessing this. And then, okay, make I also ask you, this ORS with zinc where you put here, what is the standard recommendation? Where is ORS used?
They are supposed to use both ORS and zinc.
No, Augusta. No, be
yes,
so. We are using, you even put I think I saw WHO or even UNICEF.
Yes, sir.
What is the recommendation for the whole management of diarrhea?
The recommendation is that you use ORS and zinc for 10 zinc appropriate age of for 10 to 14
where days. Is used? So ORS with zinc is recommended to be used at home.
Yes, sir.
What happened to those homemade fluids?
That is alternative, sir. But the ideal is
no. We are talking about not the ideal. We are talking about that. That's the standard recommendation. The standard recommendation. So what is their background? Let's just find out. What is their background? No go that side now.
Your background. Yes, I was asking him.
So I'm actually a pediatrician, sir.
Okay. That's why they move stuff now. Okay, not the community pediatrics like my mentor.
Professor
Actually, we encourage SSS, short solution, and if symptoms persist, they were supposed to go to the health centers where the ORS. But right now, I understand that the sachets are actually being available. So the best thing is probably, so your assessment will be the assessment of how well they constitute the ORS. Okay?
Exactly.
In a
Yes,
set
sir.
of questions, using a set of questions so that you can actually find out whether they have good practice. Or,
Yes, sir.
okay, let's just quickly know. So at least we know that you know.
Yes, sir. Yes, sir.
So we will not spend a lot of time. Okay, so move on.
Yes, sir. So,
Just move on to your result. Let's see your result.
okay, so the first result,
Okay,
social demographics.
social demographics.
180.
Just move on.
Okay.
No. Let's see your knowledge.
Knowledge, yes, sir. So,
Okay, so knowledge.
majority
Yeah.
had good knowledge.
You see, Augusta, you use 50% cutoff, but now fear don't enter here. You use 50% to say Paul and
no, this is an inject. This is an error. Yes, sir.
You see,
Yes.
that's why you have to. That's why you have that the data analysis.
Yes,
you actually certify them, categorize them into poor and good using 50% cutoff. But
yes,
here you have fair now. Personally, I prefer these three categorization: poor, fair, or average, and good.
Yes, sir.
So if it is what you use, you better go and correct it in the data analysis section.
I'll synchronize it, sir.
Yes, but this is not okay. Okay, so it's all right. So in your dissertation, you should tell us you used set of questions in assessing the knowledge.
Yes, sir.
So in your dissertation, we want you to give us the frequency of those that correctly answer the different questions.
Yes, I have it in my.
Okay, that is good. That is good. Okay, let's move. Let's move to the attitude. Okay, positive and this thing. Again, you didn't. Okay. Although you were mentioning percentage.
No, sorry. Sorry.
Just move on to the next. The
So
practice.
Yes,
the practice.
So
these are the various ways you used, the various things you assessed.
Exactly, sir.
But at the end, we are interested in the next. What should be the next table, which will be the frequency of those that with correct practice. Let's move to the next slide. Let's see. Get her.
No, sir. I am taking note of that.
No, because a lot of your cross tabulations will be between the practice and the knowledge, attitude, and social demographics. Let me see how you are able to get the subsequent. No.
Yes, the factors.
No. These factors, this is not how we assess factors. Factors are cross tabulations.
Yes.
I don't.
Yes, sir. I did.
Yes.
Yes, sir.
Factors associated with knowledge of home management.
Yes,
okay,
sir.
We tabulated the practice and knowledge.
Yes, sir.
So I hope you have the table. So
yes, sir. It's in the memo.
Yes, attitude, social demographics.
Yes, sir. Yes, sir. Okay. The tables are there. Yes, sir.
Okay, just move on. Okay.
So, in the discussion, the caregiver knowledge was high.
It's all right. It's all right. Don't worry. Yeah, high. If it is high, is it higher than other studies?
Yes, sir. It's a mixed bag. Some studies, most.
What is the explanation? What is the explanation for that?
So, I'm of the opinion that methodology and cutoff point, like the 50%, a lot of the studies use.
Which means that is what they call the type 1, type 1 error. Which it has to do all it's a design. It's based on your design or something.
Yes, sir. So because when you now
it's in there, but I just feel that the knowledge is true. Maybe I don't know. In the 90s and the 2000s, they were more, the effort at educating mothers were more intense. But right now, I don't know.
So what we found out really is that people have general knowledge is okay. However, when you now interrogate the exact practice, you find out that somebody will know about diarrhea, for instance, but it doesn't know about.
Okay, so you see, so that should be a conclusion.
Exactly.
So that disconnect between knowledge and practice, what do you think is responsible? Because that is, that is why some of my colleagues, when they say this CAP study is not good, but CAP study is actually the diagnostic tool of public health, because it tells you something. Okay, can you just help me? Just help answer it. Why do you think is responsible for that disconnect between knowledge and practice?
The disconnect is how it arises from how the message was passed. Like they just said them generally, oh, you need to give ORS, you need to give zinc. The specific of how
the specific. Okay.
And then actually teaching them so that they will observe.
Demonstrative, what they call competency based.
Exactly.
It's not to know that you use ORS to manage diarrhea.
So that's why, like in conclusion, now we are saying that the principal problem was not ignorance. It was the inconsistent translation of knowledge into full package.
So what's your recommendation? Your recommendation should be based on that.
Yes, sir. So we recommend that, for instance, okay, we have recommendation for the different.
Yes, availability is actually a factor. Availability is also a factor.
Make sure it's available.
Okay.
And then
it's all right. Agasa, unfortunately, we don't have a lot of time to to discuss more. Chidi. So you make those corrections, and then I think the process will be to let the supervisor see it as you move towards the final defense. Let him see it, make the corrections, and then show it to him. Let him look at it before the final defense. Okay?
So I can equally share with you, sir, on the side. Thank you, sir.
No, I don't review slides, so I review the full work. That's if I have time. Okay, yes, well done, Zani. Okay, you can stop sharing. You can stop sharing.
Okay, sir.